Hello, everyone, and thank you for attending today's discussion. Before we get started, I'll go over just a little bit of housekeeping. Everyone is muted as we do expect a large group today. And the event will be recorded, and we will email you a copy of the slides and continuing education unit forms about a week after the event ends. So I believe when you came in, it already said that the meeting was recorded, but I'll just look to Fabiola to make sure we are recording. All right. Awesome. So I'm going to start us off with a quick introduction regarding our new report. And then I'm going to turn it over to Allison, my co-author on the report, to moderate our discussion with 4 wonderful panelists. We'll make sure to leave time for Q&A with the audience. So my name is Kelley Dennings, and I apologize that I'm sucking on a lozenge right now. I'm fighting a sore throat. So my name is Kelley Dennings, and my pronouns are she and her. For those that are unable to see me today, I'm a petite, also could say short, white middle-aged woman with long brown hair standing in my office. I want to acknowledge that I'm on stolen Seminole, Timucua, and Muskogee land, where many individuals face displacement and suffering and hope one day they receive restorative measures. I spent 15 years working in waste, forestry, and conservation before getting a master's in public health. I'm a campaigner with the Center for Biological Diversity, working to develop and execute campaigns that address the connections between reproductive health, gender equity, endless growth, and the climate and extinction crises. First, a quick introduction about the center. We're a national nonprofit conservation organization that works through a combination of science, the law, activism, and creative media to protect wildlife and the wild places they need to thrive. On the screen, you're seeing all of our different programs, and you're going to hear from some of the folks in these programs later in the webinar. So now just to set the stage. So environmental health refers to environmental factors and toxicants that create poor health outcomes for humans. This includes chemicals, pollution, and climate change. And reproductive justice, as defined by Sister Song, is the human right to maintain bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. Unfortunately, threats to environmental health are putting reproductive justice at risk. Excuse me. Based on this connection between environmental and reproductive health, we spent the last year researching the intersections and writing a report. We're pleased to share that report with you today. Adoma, I think, is going to drop into the chat a link to the full report, which covers the topics of fossil fuel extraction, plastic products, industrial agriculture, and climate change. And the lenses through which the report focuses is market capitalism and inequity. Our capitalist society under which we operate is impacting reproductive health in many ways through air, soil, and water pollution, climate change and extreme weather events, and the manufacturing of products with endocrine disrupting chemicals. A few years ago, we were doing some listening sessions, and the issue of market capitalism came up. Since then, it continues to be identified as one of the oppressive systems harming people and the planet. However, folks find it difficult to see beyond this system that is so ingrained in our lives. We want to change that. So while we're noting these interconnected environmental and reproductive health harms caused by market capitalism in this most recent report, my colleague Adoma is simultaneously working to research alternative economic models that center gender justice, racial justice, environmental justice, and economic justice. And we hope to bring you more on that next year. With us today are environmental and health professionals that guided us in this process. You'll hear about the environmental harm and associated health effects, in particular reproductive harm. You'll hear about the systems of oppression that cause this. You'll learn about communities working to overcome these issues, and we really hope to leave you with some solutions that you can implement and advocate for. So before I turn it over to my colleagues, I have a few things to note. This report aims to provide a brief introductory overview of the relationship between the environment, racial inequity, reproductive justice, and their connection to capitalism. It does not intend, nor is it able to cover the full range of issues relevant to these complex topics. In the context of this report, capitalism refers to market capitalist systems predicated on models of infinite growth. While the discussion of capitalism in the report will frequently reference racist, sexist, and classist outcomes that perpetuate reproductive injustices, it's not the intention of the report to collapse racism, sexism, or classism into capitalism. These interconnected topics and oppressive systems are all related, making it difficult to pinpoint just one problematic system. We acknowledge that all people are affected by these issues, and gender diverse people often face additional challenges due to the lack of inclusive healthcare and other systems of oppression. Within the report and potentially this webinar, we will use gender neutral terms when possible. However, since the literature to date has largely reported results in a binary way, either male or female, we will retain some gendered language to accurately represent the best available research. Finally, I want to thank the researchers that we cite in the report, many of which represent the communities disproportionately harmed by these oppressive systems. The center plans to continue this work in 2023 through advocacy, research, and uplifting fence line community voices. My colleagues work on this regularly, and I can't wait for you to hear more from them. So please reach out if you'd like to partner. Okay. Before we move into today's discussion, I'm going to ask Fabiola to start our first poll. So this poll is for those looking to receive continuing education units. Completing this poll will allow me to do the appropriate paperwork after the event. So we'll just give it another few seconds here. So this is kind of like taking attendance. And it will allow me to send you the paperwork in the follow-up email. And we will be sharing the presentation recording with translations and closed captions afterwards, along with the few slides that I just went over. All right, Fabiola, you can close that poll. For our second poll, we'd like to get a feel for who is on the call today. So do you work in environmental health and justice? Do you work in climate change, public health and nursing, reproductive health and justice, alternative economies, or maybe something else that we didn't think of? And I'm hoping that this is multiple choice, that, you know, some of us have multiple identities when it comes to our careers. So feel free to pick more than one option here. How does it look, Fabiola? Are folks coming in? Should we share the results? Awesome. Wow. Pretty much split here. We need to work more on our alternative economies, colleagues, Adoma. But wonderful. It's great to have you all with us. So I'm now going to return it over to my report co-author, Allison Grossman, for whom this report would not exist without all of her hard work. I'll let her introduce herself and our panelists. Thank you all for joining us.
Okay, thanks, Kelley, and thank you all for being here. So like Kelley said, I'll start by introducing myself and the panelists, and then we'll jump into some questions. My name is Allison Grossman, and my pronouns are she, her. For those that are unable to see me today, I am a white woman with long, straight brown hair. I'm sitting in my office in Brooklyn, which sits on stolen Muncie Lenape land. I am a sexuality therapist, professor, and doctoral student at the California Institute of Integral Studies. And I'm currently researching the relationship between environmental toxins and pregnancy outcomes. My work focuses on the disparity of impact for marginalized and underrepresented groups and the role of state-level policy in mitigating toxic environmental exposures. And over the past year, I've worked with Kelley and the Center for Biological Diversity to research and write the report that we are presenting today. And now I will introduce our wonderful panelists. So first we have Anna Brown, who is a registered nurse with a background in emergency medicine and abortion care. She is currently the Director of Education at Nurses for Sexual and Reproductive Health, where she supports education and training that equips nurses to better include SRH into their practice. She maintains a clinical practice as a forensic nurse examiner and was a 2019 Erin Bewley Reproductive Justice Fellow through the Feminist Women's Health Center in Atlanta, Georgia. Next, we have John Fleming. John is a senior scientist with the Center for Biological Diversity in its Climate Law Institute. In this role, John's scientific work supports legal and grassroots campaigns to protect people, wildlife, and ecosystems from climate change while working to speed the transition from greenhouse gas emitting fossil fuels to clean, renewable energy sources. He received his PhD in geological sciences from the University of Southern California and an undergraduate degree in geosciences and a certificate in environmental studies from Princeton University. Next, we have Victoria Bogdan Tejeda, who is a staff attorney also with the Center's Climate Law Institute. Prior to joining the center, she worked as an associate attorney with Earth Justice, where her role included litigating toxic chemical regulations and assisting overburdened communities in advancing environmental justice. She holds a law degree from UC Davis School of Law. And last but not least, we have Nate Donley here, who is the center's environmental health science director and works on issues surrounding the increasing exposure of both people and wildlife to toxins. Before joining the center, he worked as a scientific researcher in the Oregon Center for Research and Occupational and Environmental Toxicology. He holds a doctoral degree in cell and developmental biology from Oregon Health and Sciences University. Okay, so we will get started with some questions. I just wanna, but yeah, we have everyone here. Okay, so first things first, I wanna thank all the panelists for being here. And I want to start with Anna, who is joining us today at the center for this webinar. As Kelley said, it has been really wonderful working with the Nurses for Sexual and Reproductive Health on this report and the learning model you created from it. So can you tell us a little bit about your organization and this learning module in particular?
Yeah, thanks for having me. So NSRH, or Nurses for Sexual and Reproductive Health, is an organization that works to improve nurses, students, and midwives' ability to provide sexual and reproductive health. And we do this through education, professional development, and advocacy building. As the education director, I help coordinate our online institute, which has modules like the one we've just built, as well as webinars that address various topics under the sexual and reproductive health and reproductive justice umbrella that are commonly overlooked or not addressed in school. The environmental justice module we created with the center's report in collaboration is our newest offering to the online institute. And in this module, it was important for us to communicate the physical health consequences of environmental harm and to contextualize how these harms, in combination with other extractive policies, disproportionately impact our patients of color and specifically low-resourced communities. And by educating healthcare workers on this environmental justice framework, we can improve both our patient assessment and monitoring, as well as increase our ability to advocate for patients and the environment together.
Thank you for that. So with that introduction in mind, let's jump into the report itself. We will start with the fossil fuel section, where we talk about the capitalist fossil fuel extraction system, which includes everything from removal of the fossil fuels through processes like fracking and mining, to transportation of the material, and then to eventual combustion. John, can you tell us how this system harms our environment and people?
Yeah, thank you for the question. So as kind of hit on with the question, when you're talking about fossil fuels, it's important to talk about the full life cycle of those fuels, meaning the stages from production all the way to combustion, and the environmental and health harms that come at each of those steps. So even prior to production, in the process of drilling an oil or gas well, for example, you have habitat disturbance, you have the displacement of wildlife, and the pollution associated with that drilling. And then once a well is up and running, producing fossil fuels comes with emissions, both climate damaging greenhouse gas emissions and health harming air pollutants, many of which are known carcinogens, respiratory irritants, endocrine disruptors, and pretty much chemicals that could hit like any of the systems of the human body. And these harmful emissions are also found during refining and ultimately in use. So when you gas up your car or at the power plant to produce energy in your home, like thinking about like gas appliances. So the fossil fuel extraction system is ultimately harmful for the climate, it's harmful for people, and the natural environment. And despite all of that, because the fossil fuel industry has produced so much wealth for the industry and business shareholders, with that wealth giving a lot of influence for our decision makers, the fossil fuel industry, has this vice grip on our society, that we're now at the center and in other places, working hard to break.
Yeah, thank you, John. And I think going from fossil fuels is a really good transition into the plastic section of the report because of the role fossil fuels have in production, as you kind of mentioned. So in the plastic product section of this report, we again talk about the system associated with creating plastic products and all the toxic exposures throughout the plastic life cycle, which starts with the extraction of oil to create plastic, goes to the factories that create the products, to our personal use of plastic products, and then the ultimate disposal of plastic. And all along that chain, there are implications for our communities. But plastic remains really ubiquitous in our daily lives. And when I was writing this report, I was really struck by how largely unmitigated and even unnoticed this harm often goes. So Victoria, can you shed some light on the harm of plastic production and plastic use that most people may not be aware of?
Sure. So as you were saying, plastics are a dangerous combination of toxic chemicals and most commonly fossil fuels. And so in terms of the chemical inputs, I think it's helpful to think about the entire life cycle of these chemicals and how they're unhealthy and damaging to people and the planet. So to set the stage, one can think about the different qualities that companies may want in plastics. So maybe that's flexibility or fire resistance, being water repellent, maybe stable under sunlight. And there are different chemicals to achieve each of these qualities. And so you can imagine then the hundreds of chemicals that exist that companies may use. And if you think about the life cycle of the chemicals, you can start with the creation of the chemical. And in the US, many of the most harmful chemicals are manufactured in the Gulf South. So you can think Louisiana, Mississippi, parts of Texas. If you've heard of a place called Cancer Alley in Louisiana, this is it. This is where a lot of these chemicals are created and processed. So almost all of these communities are environmental justice communities, meaning they're already overburdened with terrible pollution. And so at these chemical manufacturing sites, you get air pollution, water pollution, contributions to climate change, risks of spills and leaks, and dangers to the workers handling these chemicals. But then it continues. So once you have this chemical, it then is added to plastics. And these may be at the same facilities or different. Most assuredly, these facilities are also clustered in low-income, overburdened areas, and you get the same harms: air pollution, water pollution, and dangers to workers. But then we continue. So now you have the plastic, and that's in the hands of people. And I think a key point is that the chemicals that went into creating these plastics don't stay locked into these plastics. They're continually off-gassing into the air. They're shedding particles onto people, onto the floor in dust during use. You can think about how then adults and children are exposed to these. And there have even been studies showing the presence of these chemicals in pets because their toys are plastic and the pets are often, down on the floor with the floor dust. And then just to wrap up, so once you have this plastic product that then is disposed of, what happens then? If you put that in a landfill, then those chemicals can get into the soil and water. If you incinerate those plastics, then you have the chemicals going into the air and the ash from the incineration. And even what little plastic actually gets recycled often means that these toxic chemicals are then kept in the waste stream. And so much of recycled plastics are made from the hard plastics that have encased electronics like TVs and radios. And those types of plastics are particularly high in certain types of harmful chemicals. And then when those recycled plastics get turned back into consumer products or children's toys, that's just continually offering those opportunities for chemical exposure. And I would just end by saying how testing of human samples has consistently shown that nearly all people have chemicals that are used in plastics in their bodies.
Yeah, thank you for that summary, Victoria. I mean, it really highlights just the degree societally and then individually that we're kind of coming into contact with all of these toxins. So I want to switch to another major industry in our country, emitting toxins, which is industrial agriculture. And this section of the report addresses two things: animal agriculture and pesticides. And it was really quite a hefty chapter to get at both of these subsets of industrial agriculture. So Nate, can you break both of these issues down for us? Talk about maybe how they impact the environment and health?
Sure. Well, I'll start with CAFOs, which are concentrated animal feeding operations, also known as feedlots or factory farms, are all the same. It's basically small spaces where a ton of animals are packed in tightly at a very high density. Can lead to a whole host of issues, and most of the meat we eat in this country come from these places. People who live near or work near CAFOs can be exposed to things like methane coming from the animals, dust, high levels of dust, which is kicked up from just the normal animal behavior, ammonia that's coming from the animal waste, and then of course all the pathogens. And then the high use of disinfectants in these places to try and keep those pathogens at bay. All these can lead to things like significant respiratory disease, just air pollution in general. Methane, despite being a potent greenhouse gas, can also convert into ozone. Exposure to ground level ozone when you're pregnant is associated with things like low birth weight. Ammonia can readily convert into particulate matter, or PM2.5, which is associated with asthma in adults and children, but even someone who is pregnant who is exposed to PM2.5 high levels, your developing fetus will eventually is more likely to develop things like asthma when they're, after birth. And pesticides, on the pesticide side, we use pesticides widely on crops that go to feed people as well as animals. And animal food is actually a huge driver of pesticide use in this country. We use about 200 million pounds of pesticides just on corn, soy, and hay that are used to feed animals. That's a full fifth of our total pesticide use in this country is just on food for livestock. So pesticides and animal agriculture really go hand in hand, and exposures to pesticides can be really high. You can be exposed through your diet, your water, and if you're in close proximity, through things like dermal absorption and even breathing it in through the air. And many pesticides are known endocrine disrupting chemicals, meaning that they can interfere with the normal hormonal cues and signaling in our body. And there's really no time other than pregnancy that your hormonal system has such an enormous influence on the body, more so than even puberty. And so you want it and you need it to be working correctly. And many pesticides, due to their endocrine disrupting ability, are known reproductive toxicants that can cause things like irregular menstrual cycling, low sperm count, low sperm quality that can impair your ability to conceive. And then during or after pregnancy lead to things like preterm birth, low birth weight, and developmental disabilities.
Yeah, thank you, Nate. That's a really great summary of a lot of technical information, so I appreciate it. And I want to come back to John with a question about climate change. The final section of this report actually wasn't specifically about toxicity, but instead about the consequences of climate change on health and the environment. So can you give us an overview of how the climate crisis harms our environment and also people?
Sure. So much of the harm, we're experiencing from climate change is because the climate is changing more quickly than we can easily adapt to. The most obvious changes we see, are, wildfires and drought in amounts we haven't seen before, heat waves and extreme storms. Those are all the things we're familiar with. With these events resulting in potentially injury and death, property damage, the displacement of people. And this is all expected to only get worse in the future as climate change progresses. But as difficult as it is for humans to adapt to the pace of climate change, it's even more difficult in some ways for plants and animals to adapt. As a result, some species are being displaced as they search for hospitable environments, with others being driven to extinction. And there are other effects that we may not think about, including greater difficulties in food production, reductions in the nutrient density of crops, loss of pollinators, and the proliferation of certain diseases that are kind of tied to temperature. So ultimately, our problem with climate change is that our baseline for what's normal in our environment is shifting, and our current way of life is no longer compatible with a healthy planet.
Yeah, thank you for that, John. And I appreciated you kind of noting the way that, yes, it's climate events, but all the ways these kind of trickle down into our daily lives, from food security to pollinators and all of these really important things that kind of help us function. So thank you all for the great overview of how these systems impact us and the environment. We're going to talk a little bit about health next, and I just want to remind everyone tuning in to be sure to put your questions in the Q&A box at the bottom of the Zoom screen. And then now we will chat a little bit about health. So obviously, as most of you have already touched on, human health in general is compromised by the outputs and the toxic exposures emitted from these capitalist systems. But this report focuses specifically on the harms to reproductive health. So Anna, can you tell us a bit more about endocrine disruptors and how they can harm our reproductive systems?
Yeah, thanks. So Nathan started to touch on this already, but EDCs, or endocrine disrupting chemicals, are substances that interfere with the normal functioning of the body's endocrine system. And our endocrine system is responsible for the production and regulation of hormones throughout our body. And these hormones impact basically every system within our body, from metabolism to reproduction to breathing to sexual development. These are hormones like estrogen, testosterone, to thyroid stimulating hormone. And endocrine disrupting chemicals impact the function of the endocrine system by either mimicking these hormones, inhibiting their production, or altering our body's natural sensitivity to these hormones, which cause overall endocrine dysregulation. And as you've kind of heard the other folks talking about, these EDCs can be found in a variety of products that we're exposed to every day, from pesticides to beauty products to plastic products. And thinking about the overwhelming number of daily exposures to EDCs and how the endocrine system impacts all of our body systems, it's not surprising that the impact of EDC exposure has a variety of side effects and consequences. An example of this specific to reproduction is looking at EDCs in beauty products like skin lightening creams. So EDCs are present both in the packaging of those products as well as in the products themselves. And these products are heavily marketed to people of color, specifically women of color. Thinking about the links between EDCs and health consequences like endometriosis, there are direct links between EDCs and endometriosis. And that is, the endometrium is the lining within our uterus, and endometriosis is when that tissue is growing outside of the uterus and other parts of the body. Some of the main symptoms of endometriosis are severe pain and heavy menstrual bleeding. So thinking about the over-marketing of these products with EDCs to women of color in combination with medical racism that specifically Black women experience in healthcare, we see documented delayed diagnosis and delayed treatment of things like endometriosis. And this has ongoing ongoing consequences, from chronic pain to infertility, which is a common side effect of endometriosis. And this is just one example that we point out in our module of how the connection between environmental harm, reproductive health, and other systems of harm impact human health.
Yeah, thank you for that, Anna. I appreciate you touching on kind of this disproportionate impact, because something that was kind of continuously struck by her and was like really repetitive throughout this report when I was researching it was both the ubiquitous nature of exposure, but also the disproportionate impacts and exposures of EDCs on different communities' health. So I want to think about that in the 4 subtopics for the rest of the panelists. In regard to fossil fuel extraction, this report highlights harm done specifically to communities of color, Indigenous communities, and then the gendered impacts of fossil fuel extraction. So John, I'm wondering if you can share an example with us where fossil fuel extraction is harming a specific community or group of people.
Sure. So I live in Los Angeles, and Los Angeles is the largest urban oil field in the United States, meaning you have people living very close to oil and gas extraction. So there have been studies looking at respiratory issues resulting from this proximity to oil and gas development. And what was found is that people, looking at 2 South Los Angeles neighborhoods close to oil wells, were diagnosed with asthma rates significantly higher than California's overall rates. And in one of those neighborhoods, at least, higher than the LA County rate. And then there was a second study that found that people living downwind and close to active wells had significantly lower lung functioning than those living upwind and further away from wells. And also, people living near active wells reported symptoms of chest tightness, wheezing, eye irritation, compared to those not near active wells. And what's important to mention on top of all of that is that in these studies, about 70% of the population experiencing these elevated asthma rates live 200% below the federal poverty line. And citizens were mostly Latino, mostly renters, and which points to kind of the environmental justice implications of continued oil and gas extraction, where low wealth communities and communities of color are often the most harmed. I will say that now, thanks to years of a lot of work by frontline community members to end neighborhood oil drilling, the city of LA has announced plans to phase out oil and gas extraction in the city, as has unincorporated LA County. So finally, there's some acknowledgement of these disproportionate impacts of fossil fuel extraction near people.
Yeah, thank you for that, John. I really appreciate you noting the kind of grassroots effort, because I think that's something that we often kind of gets overlooked society-wide, and it's really such a driver specifically for environmental justice. So I appreciate you naming that, and I hope it goes through in LA. So moving back to Victoria, in our society today, as you mentioned, it's really hard to get away from plastic. Some of these chemicals are known as like forever chemicals and everywhere chemicals, right? Really suggesting that they are everywhere and they last forever. So because of that, it seems like nearly all of us would be impacted by plastic production and products. But obviously some communities experience much greater harm. So I know there's a lot of examples of this, but can you share just one with us to give us some insight?
Sure. So when I hear the term forever chemicals, one thing that comes to mind for me is a group of chemicals commonly referred to as PFAS, so PFAS. And these are chemicals that, because of their makeup and their structure, they last a long, long time in the environment, in tissue, animal tissue. Some folks may have seen the movie Dark Waters, that explores the harm that an early version of PFAS had on a community in West Virginia. And these chemicals are found in food packaging and textiles very commonly in many, many items. And so one example that isn't plastic related, but that people may not be aware of, is the presence of PFAS in firefighting foam. And so if you've seen images of firefighting foam being used, in forests and other places, you can think about how then the chemicals in that foam are getting into the ecosystem, into the watershed, into plants and animals. And that's one example that may not be on people's radar, but I think is good for people to know.
Yeah, thank you, Victoria. I mean, I think, when you say that, it kind of highlights to me of just how subtle and constant the presence is of these certain chemicals and how they're kind of going on all the time, even in some, good processes, right? So we kind of miss the harm being done, like you mentioned. Okay, so I want to go on to Nate. As we said before, industrial agriculture includes both the harm done by animal agriculture and also pesticides. And because of the profit-driven nature of industrial agriculture in the United States, are there communities and groups of people impacted by both of these issues? And if so, can you tell us about one?
Sure. So, as with pretty much all profit-driven industries, marginalized communities are experiencing the pollution burdens the most. And in agriculture, like every other industry we've talked about here, that generally means people of color. Agricultural workers like farm workers who toil in the crop fields, harvesting food for us to eat. And those who work in slaughterhouses or feedlots are often Hispanic or Latinx. Some are undocumented immigrants. Many don't speak English. And most are reliant on their employer for living essentials like housing and food and water. And so as a result, this is really a vulnerable population that is often exploited. And because farm workers and slaughter and feedlot workers often reside near their work, the harmful exposures are constant. It's not just during work hours, because after you're off work and you go home to your family and you sleep in your home is still in this area that has a very high pollution burden. So the exposures are really around the clock, 24/7. And if you are pregnant or trying to conceive, this can really significantly impair your ability to carry a healthy child to term.
Yeah, thank you for that. When you were sharing this, Nate, it made me think about the generational injustice component of everything we're talking about today. So never mind this kind of dependency on this toxic industry to make money to live and all the other, systems at play here. But if you can carry a child to term, which Nate noted is pretty tricky, because of the influence of these toxic chemicals, a lot of exposure to those chemicals is passed on to that baby. And as you mentioned, I think in that first round about, then those babies growing up with asthma and other diseases and disorders. So I think it's useful to kind of frame this generational component of all of these exposures that all of you are talking about today. So we'll go on to one more question to John. I just want to remind everyone we will be going to Q&A after this, so feel free to throw any questions you have in the box below. And so finally, back to John. People around the country and the world are feeling the harm of climate change. As you mentioned, most recently it's been felt in this country with extreme heat waves, flooding, wildfires. Since extreme weather events seem to be all the time and everywhere, is there one community or group of people most impacted by this that you could talk about and share with everyone?
Well, like you said, people all over the country are starting to feel the harms of climate change. So it's really hard to, really focus in on one. And like I've mentioned, we have Californians who fear the wildfire season every year because of the uptick in record-breaking fires over the last 10 or 20 years. Then you have the Gulf states where people live in fear of hurricane season because the number of Category 4 and 5 storms has increased also over the last 10 or 20 years. Then you hear about polar vortexes, bringing cold weather to the Northeast and the Midwest. Flooding in Kentucky this year, and now, nationwide heat wave. So we really live in a world now where everything seems to be unprecedented. So you really don't have to point to a place on the map to find a place or a community that's somehow affected by climate change. And in all these cases, those most vulnerable tend to be low wealth communities and communities of color, I'll say again, and also subsets within that, meaning children, the elderly, those with disabilities who overall have fewer resources to adapt to these extremes in weather. And one example I will lift up is Victoria mentioned Cancer Alley, just because when you have this confluence of potential hurricanes and like the petrochemical industry, imagine a hurricane coming through an area like that, flooding these facilities, leading to more pollution than you already have. So there's just, climate change is touching a lot of different communities, and it's projected to get worse in the future, unfortunately.
Yeah, I mean, I think you make a really good point, and this is, you know, kind of a good grounding commentary here about the way that climate change and how the environment is impacted really impacts all of these other areas that we're talking about today, and really perpetuates exposures even more so than, you know, we're already experiencing them. So with that, you know, kind of overwhelming commentary, this feels like a good time to get some action items, so we know that there's things we can do to improve the situation. So can you kind of all go around and just name a tangible action item people can take to advocate against or mitigate the harm we've been discussing today? And then we'll move on to questions from the audience. Anna, do you mind going first?
Sure. So one of the things that we really focused on in our solution section was breaking it down by the individual action, an institution action, and like a policy level action. But for an example here of the individual action, I think one of the biggest skills that nurses, healthcare workers, and public health folks have is being able to educate themselves and their patients or community. So really looking at what the risk factors, the environmental risk factors are in your area, and then how can we help educate patients on mitigating that harm? So if you live somewhere that has a high population of agricultural workers, what sorts of things can you educate patients on for effective cooling and hydration techniques while they're at work? If you live in an area where there's other types of environmental exposures that cause dysregulation in people's menstrual cycles, what are you doing to help patients understand their bodies and track their periods in case they become pregnant and need access to abortion, which state by state is becoming harder and harder to do, especially if someone isn't able to regularly monitor or have a monthly period. So those are just two examples of the ways that we as healthcare professionals can understand what's going on in our community and then translate that into prevention and action for our patients.
Thank you, Anna. And I want to highlight that for non-healthcare workers too, if you're learning this information and it's new to you, as I think it is for most people, it was to me when I first got into it. So, share it with people in your life. I think talking about this is, to Anna's point, that education piece goes a really long way in just knowing about these risks. Okay, so I will go on to John for action items. Maybe you can give us some for climate change and fossil fuels.
Yeah, so I will make the point that a lot of the work we need is kind of system level. So, we need really like our leaders, decision makers to really make big, bold moves on climate. But if we're talking about individual things for people to do, basically things in your individual life that, minimize fossil fuel usage. Depending on your ability, like using public transportation, considering electrifying your life a little more, electric vehicles. And I say based on your ability because there are still hindrances to certain people accessing some of, like electric vehicles at this point in terms of pricing. But as much as you're able, switching to electric appliances, really getting into kind of the solar panels on your home, just minimizing meat consumption, even like things that just minimize what you would call your carbon footprint are individual actions, in addition to, really leaning on decision makers to make those bold institutional or system-wide changes.
Thanks, John. Yeah, and I want to amplify what you've said of, yes, we should all feel empowered to make changes in our life. And this is an industry level issue. This is a governmental issue in a lot of ways, right? So we can be mindful of putting the onus on individuals when so much of this is happening at an industry level. So I really appreciate what John is saying of, yes, think about your own choices and also put pressure on your local legislators and politicians to make these bigger policy changes too. Okay, Victoria, can you share an action item for everyone?
Sure. So with regards to plastics, I think that there are a lot of good resources out there to describe alternatives to plastics in our lives. And I encourage people to look at those. And if you find alternatives that work for you, share those with your community, tell people about it. Or one thing that I did, for example, my parents would use a lot of single-use plastic water bottles. And so for the holidays, I bought them metal water bottles that they could refill and reuse. And so even those kinds of like simple nudges, but it's true, it's not just about our individual changes, it's also about system changes. And to go back to what I was saying about the life cycle harms of plastics, to remember the fight against fossil fuels is also the fight against plastics. When you hear about communities fighting petrochemical plants, that's referring to these facilities that most likely are manufacturing plastics. And so supporting the communities who are really on the front lines of where these plastics are coming from, or even thinking about, changes to what's called procurement. So what are agencies, what are local governments buying? My colleagues, for example, are asking the federal government to stop purchasing single-use plastics, but can you do that in your town? Can you do that in your local municipality? So pushing for like these broader changes as well that go beyond the individual.
Thank you for that. Yeah, that's a really helpful takeaway and something to think about, especially like what you said about supporting these communities most impacted, since we're all benefiting from the product, right? Or benefiting from the product, as the case may be. And finally, Nate, any action items that you can share with us?
Yeah, I would say on an individual level, eating less meat is something that most people have the ability to do right now. So, plant-based options are broadly available and they're generally at similar or cheaper pricing. So this doesn't mean you have to become a vegetarian or vegan overnight, but even just reducing your meat consumption a little, like instead of eating meat for 3 meals a day, try doing it for 2 or 1, just wherever you're able to, to get to, is a great thing that people can do. Pesticides are a little more complicated. Some of us have the privilege of being able to afford and have access to things like organic food. Again, some of us have the privilege of being able to filter our water, our tap water, our groundwater that we have in our homes, but not everyone has that ability, and it's important to acknowledge that. So, that's where I think if you have the privilege to be able to do that, buying organic, filtering your water are great things to do, but we really need regulatory solutions, system-wide change to come in and really create greater oversight here. So, we need better testing of chemical mixtures that are out in the environment, greater oversight of things like antibiotic use that are used widely in factory farms and can lead to things like antibiotic resistant infections. And then, of course, the conditions that give rise to all that antibiotic use and tighter air and water pollution standards near these facilities. And then, of course, legislative fixes. Right now, there's a bill introduced in the Senate by Senator Cory Booker late last year called the Protect America's Children from Toxic Pesticides Act, which would really be a true overhaul of our pesticide regulatory system, and a change that we haven't seen since the 70s, since we started regulating pesticides. Clearly it faces a major uphill battle in Congress and probably won't get passed, but the more support we show bills like these right now, the better place we'll be in when we're in a political climate where, major reform of our regulatory systems can get pushed through and signed into law.
Yeah, thank you for that. I really appreciate you actually naming, an act. It can be a really helpful, kind of grounding opportunity to be like, okay, here's an act I can look at, a policy I can look at and take action on. So with that in mind, we've gotten a ton of really great questions. I will start at the top here. So Anna, a first question for you is, with toxicants making health pregnancy outcomes more difficult, and the current political landscape in the US where negative pregnancy outcomes are being prosecuted, how will the most vulnerable people be protected? And are there current or planned communications with policymakers about this reality? So kind of this idea of how is the impacts of environmental toxins being considered in the political landscape around all the changes happening. And you kind of hinted at this before, so maybe if you can just expand on it for a moment.
Yeah. Well, the federal level is not really interested in ensuring pregnancy outcomes are available to everyone. So that's pretty clear. Of course, there is plenty of work to ensure state level access to comprehensive pregnancy options, from contraception to abortion to expanded Medicaid coverage for parental leave. So these are all things happening at the state level, because that's kind of where our default action is available right now. In terms of the environmental awareness around pregnancy implications from infertility to the development of a healthy fetus, all of these things are, from my understanding, I'm sure there is work going on around this, but that intersection has not really been clearly drawn, I think, especially because a lot of the sexual and reproductive health care community is in a jolt right now. So they're trying to get anything passed or make sure anyone has access. So when we end up in this kind of urgent and emergent situation, I think sometimes the environmental connection can get lost. So that was part of what we wanted to uplift with this environmental justice module, is that environmental health and reproductive justice and reproductive health cannot be decoupled, and what sorts of actions and health outcomes can we expect and can we advocate for from the personal level, institutional level, and especially the policy level. Unfortunately, I don't have any clear examples of where that connection is happening right now, but hopefully this module, and especially the center's report, will just continue to highlight those relationships.
Yeah, when you said that, it brings me to this other question someone asked, because we talk a lot about, in the news and kind of society, we talk about these issues in silos and we very rarely bring them together. Which brings me to this next question for John about the impact of high heat on pregnancy. There's so much news coverage about heat waves going on and what it's looking like, but very little about like the impact of that on pregnant people. So I wonder if you could speak a bit about that.
Yeah, so some of the effects are in some ways similar to what I talked about in terms of like chemical exposure to oil and gas extraction, where there are studies that point to increased risk of preterm birth or early birth, or even birth defects in response to extreme heat conditions. So in short, yes, there is evidence that there is some effect of high heat on pregnancy.
Okay, thank you. Yeah, I know I've read actually in California some examples of just higher outcomes for people really experiencing that heat in Southern California. So I appreciate you highlighting that. I will go to Victoria next for kind of a dual question that I'm going to combine because I think it gets at the same thing. So someone says, is there global work taking place that I can follow related to plastic pollution? And pseudo adjacent to that is, what real alternatives do we have to disinvest in plastics? So maybe about global work taking place, and then also like what are we really talking about here?
Great. There is global work taking place to address plastic pollution and manufacturing, and all of the harms are really a global problem. And I would direct people to look at a group called Break Free from Plastic, which is a global movement envisioning a plastic-free future. They launched several years ago, and they have a global focus as well as work that happens in the United States. And some work that's come out of a number of groups there in concert with the UN is that recently this year, over 150 countries in the United Nations as part of the Environmental Assembly signed on to create a global plastics treaty with the aim of addressing plastic pollution. And so that process is ongoing, and a lot of work from advocates really went into pushing that. But Break Free from Plastic is really the hub for that global work. And in terms of genuinely disinvesting from plastic, I think a big part really goes back to the fight against fossil fuels and how important that is for addressing our climate crisis, but then also thinking about how fossil fuel companies, even with fluctuating energy prices, really benefit from selling a lot of what they're extracting out of the ground to go into petrochemicals. And the petrochemical industry, the plastics industry, can really be a lifeline to fossil fuel companies. And so by fighting both, we're really helping to disinvest in plastic as well.
Yeah, I appreciate you naming that connection so explicitly, right? I mean, it seems like one of those things that's really obvious, but also not, and really easy to separate when we're just looking at maybe plastic production or a plastic item, you know, where that comes from. So that's a really helpful response. I appreciate that. Okay, a question for Nate. What causes the most harm, livestock or crops? And then it's kind of like a two-parter. What can we do to mitigate these risks as individuals and consumers? And also like lead the healthiest life possible. So kind of a jumble of questions. Does that make sense, or should I break it down?
Sure. Yeah, you know, when I think about this, you know, when you obviously eat plants like vegetables or grains, there's inputs that go into that. You know, greenhouse gas emissions, toxic exposures. But when you're eating meat, you are essentially, you know, taking all of that plant-based stuff that you would have just eating plants, and then you're adding that on top of the pollution burdens that are created by growing, you know, all these animals in such a small amount of space. So a plant-based diet is generally going to be much better for the planet and generally your health. So I would say that, yeah, you know, even eating non-organic plants is going to be, you know, less of a burden on the environment and individual health than eating a you know, mostly meat diet.
Okay, I appreciate that. Thank you for that answer. I'm just looking through these questions to prioritize with the couple minutes we have left. So something that's kind of coming up as a theme, and maybe this is a question for everyone to kind of speak to before we sign off, is questions about, do you have optimism about the awareness of these harms and or our ability to push corporations to make substantial change? I'm seeing that kind of in all of these areas. So I wonder if people have thoughts on that. Maybe that's like a good final foundation to leave people with. Anyone can jump in
really quick. I was definitely seeing this theme of, you know, individual action is important, and this is a system-wide global issue that needs to come from the top, which I agree with. And I think something that has been important to remind our members and community is that capitalism also works to isolate us, to feel powerless to impacting change. So building community around environmental action can help kind of mitigate that sense of isolation that, you know, we've been talking a lot about capitalism impact on the environment, but it also impacts the way that we feel we can make change. And having community that is aligned with environmental action on a small to large scale can help mitigate that capitalist model that we're currently working in. And I think the environmental justice framework really helps not only get at ways to view environmental harm in a larger kind of system, but also ways to view the way how and we can take action around these environmental harms as well. So I think that's been a helpful thing to kind of remind ourselves going forward, because it can get easy to get lost in the scale of what is going on.
Yeah, absolutely. Any other, I know we have like 45 seconds left, but any other thoughts on kind of pushing back on the weight of corporations and our systems in these discussions from the rest of you.
Well, I popped back up because I just wanted to close us out. Anna, I think you summed it up just perfectly with that final thought. So I will also say there was an excellent question from Pete Pastors, who, if I know that name, it's somebody that I know from a long time ago, but he says the actions you suggest are great, but how would you suggest we address the root cause, capitalism? And we did talk about this at the very beginning. So I'll briefly say, in conclusion, the root causes of extinction, pollution, and climate change are the same forces of systemic oppression and the marginalization of exploitation of humans. So we hope that this webinar and the accompanying report helps lead the way for more health and environmental groups to work together. Please reach out if you'd like to partner. And as I mentioned in my welcome remarks, we're simultaneously working on supporting this economic transition that Pete mentioned. So that embodies values such as solidarity and cooperation, equity in all dimensions, social and economic democracy, sustainability, and pluralism. So sign up for our newsletter to learn more about that in the coming year. I think Adoma is placing some of this information in the chat for you. Finally, I want to thank the researchers we've cited in the report, my report co-author and moderator, Allison, and Adoma and Fabiola on tech. Thank you to our panelists, Anna, John, Victoria, and Nate. I am so proud of the center right now. You don't understand. And all of your work is so necessary. And thank you for sharing your insights with us today. And thank you to everyone watching. And you will get the slides. You will get a recording. You will get a certificate if you wanted continuing ed credits. And we're going to share with you lots of options to get involved to support people on the planet. So lots of different action items in this follow-up email that will come out in about a week or so. When you close the webinar, you're going to get an option to do a short evaluation. We please hope you do that. And thank you all for attending. Have a wonderful day. Again, thank you all so much. Great job.
Thanks, Kelley.